Right, so we are going to start pathology. Pathology is the study of human diseases, causes of suffering. So, the main thing I want to tell you is that this is not going to be a lecture where I focus on you remembering definitions. It's not about memorizing anything. What you should do is you should try to understand what's taught. So, we're going to start the first part now. The first topic is cellular injury. Okay, we are going to learn some words which will come up often. First of all, the word hyper. Hyper is a prefix. You put it in front of another part of the word. It means to increase something, increase in size, number, whatever it is. Or it could also mean that something has increased. Hypo. Hypo is to decrease. Could be the number of cells or could be something that is already low. Hypocalcemia is low calcium. Hypercalcemia, it's high calcium. So next, two other words. One is plasia, that means new growth due to cell division. We will talk about three main things. One, metaplasia, hyperplasia, neoplasia. Neoplasia means new growth, and that is basically seen in tumors. Trophy is growth. This usually occurs in the size of the cell. And whenever we add the word a in front of another word, it means not. So in this example, aplasia means no growth. This is seen in kidney aplasia, where one kidney forms while the second kidney does not form. Another one, atrophy. The growth is reduced. There's no growth, so the cell size decreases. Then we're going to talk about this word called inflammation, which is a big topic in the next chapter. The thing you need to know is diseases usually end with the suffix itis, nephritis, cellulitis, and so on. There's so many diseases which end with this suffix that should tell you it's an inflammation. So what is inflammation? Inflammation is our defense mechanism, our body's own defense mechanism. This is done by the white blood cells and fluids, fibers. They all come together to usually fight off an infection or to fight off any foreign bodies such as silica deposits. And another word is hypoxia. Hypoxia means low oxygen. This is apart from histology. I need you to know that there's 4 types of tissues. Epithelial, connective. Connective tissue is mainly bone and blood. Nervous tissue and muscle tissue. Nervous tissue and muscle tissue do not divide except smooth muscle cells. So cardiac muscles and skeletal muscles cannot divide. Next, I'm going to quickly talk about cellular injury. First of all, I'm going to take a cell and give it a stress. Stress could be anything that the cell is not used to. It could be low nutrition, it could be trauma, it could be pressure. It could be some tumor or some cells pushing against that cell. So when this stress is given, the cell has to either adapt or it gets injured. An injury can lead to cell death. When it comes to adaptation, that is a reversible change, and 4 things can happen usually. So wherever I draw a nucleus, I will try to draw it in purple, because the nucleus stains on H and E in purple. This is very important when we do slides in pathology. So first, adaptation. Hyper, increase, trophy, growth, cell growth. This is best seen after you go to a gym and work out. So when you go to the gym, the muscles are given a workload that it cannot handle. So what does it do? That's a stress. What does it do? It grows. This is the whole concept behind bodybuilding. Because muscles can't divide, these cells are permanent cells and they cannot divide anymore. This is also seen in pregnancy and in lactation. Pregnancy includes both hypertrophy and hyperplasia. Hyperplasia is new cells are produced. Physiologically, you can see this in pregnancy, red blood cell division in the bone marrow, menstrual cycle. But in pathology, the best example is cancer. The growth is diffuse or nodular. That means the growth can either happen in a very equal way throughout the organ, or it can happen as nodules, small nodules on an organ. Next is atrophy. There's going to be a decrease in cell size, and along with that there's going to be a decrease in cell number. The following are causes of atrophy. First, nutrient decrease. You can see that in cancer cachexia. This word will be taught in cancer. It's basically wasting away. It's a state of malnourishment where the patient looks just wasted. And pressure. So let's take a blood vessel which is obstructed by a tumor. So the tumor, the cells will push on the blood vessel or the ureter. Let's take the ureter. That is going to push on the cells, and those cells will undergo atrophy, and there will be a ureteric obstruction. This is due to pressure. Then another type is disuse. When you don't go to the gym, when you don't work out, you lose the muscle mass because the stress is gone. There's no need for the body to just waste a lot of energy on those muscles. Then there's denervation. This is because the nerves to that area has been lost. You can see this in carpal tunnel syndrome, where the median nerve, when it's damaged, it will cause the thenar muscle, the muscle which you can feel as a bump connected to the thumb. It has wasted away. Kind of looks like a U. So this occurs in two ways. First, decrease in cell number occurs by a decrease in protein synthesis and an increase in protein breakdown. The number of cell is decreased by apoptosis. The pathway that the cell size is decreased is something called the ubiquitin proteasome pathway. So in this pathway, ubiquitin molecules go and tag intermediate filaments of the cytoskeleton. So the cytoskeleton decides the size of the cell. It's basically the framework of the cell. And to this, a proteasome will come and find these tags and destroy that area. It digests that area, so the cell becomes smaller. The last change is metaplasia. In this, the cell type changes to better handle the stress. This is best seen in the esophagus. This is a condition called Barrett's esophagus. In this, we have the esophagus is lined by simple stratified epithelia. But due to acid reflux, due to conditions where there is acid reflux, the acid goes and touches these stratified epithelial cells, which can't handle the stress. So what they do is, they will be replaced by columnar cells, which can handle this. This is very important. If the stress is not removed, this can lead to an adenocarcinoma. Adeno means gland, carcinoma. This is a glandular epithelial cancer. Some other examples are vitamin A deficiency affects the eye in a condition called keratomalacia. So the normal development of the eye requires vitamin A. When there's a decrease in vitamin A, there's going to be something, there's going to be metaplasia where the normal cell type is changed to another, and in this you will see it looks like cataracts. On the eye, the transparency is lost. So those are the 4 types of adaptations we see. Next, we are going to do reversible injury. See, the word here is very important. Reversible. Adaptation is reversible. Reversible injury is reversible. And the hallmark of reversible injury is cellular swelling. This could be due to water accumulation or fat accumulation. So let's take water accumulation first. First of all, there's going to be hypoxia. Let's say there's hypoxia and then the oxygen supply to the cells decrease. The mitochondria cannot produce enough ATP because it changes from aerobic to anaerobic respiration. Then when the ATP is decreased, it's going to inhibit the sodium potassium pump, ATPase pump. This is a pump where 3 sodium is kicked out and 2 potassium is taken inside the cell with the expense of ATP. So this is a very important thing. Wherever sodium goes, water goes. So sodium cannot leave the cell. Water will retain in the cell with the sodium. It's going to accumulate, the cell is going to swell, and the membrane will start to bleb. Anything that's stuck to the cell, such as microvilli, is going to get kicked out. And even the ribosomes attached to the RER will be kicked out. Next is fatty changes. This is what obesity is, what growing fat means. So our body has around 30 million fat cells. Those fat cells have a single globule, have a globule of a fat droplet, a lipid droplet. So let's say there's obesity or alcohol abuse, the fat droplets accumulate and increase in size. So the fat droplet will keep increase in size the more there's fat given to it. And if you look at this diagram here, you can see that on the top you will see the normal cells, small fat cells, and on the bottom you will see enlarged fat cells. So the normal cells, the oxygen can diffuse through, because the oxygen diffusion distance is enough for the cells, all the cells to get oxygen. But when the fat droplets size increase, the cells behind, as you go further away from the blood vessels, cannot get enough oxygen, because oxygen cannot go that far. Without oxygen, that's a stress, cells die. Next comes irreversible injury. The hallmark of this is membrane damage. And I want you to understand, this talks about all membranes inside the cell, not just the plasma membrane. First of all, I'll take there's 3 main membranes I'm going to talk about. One is the mitochondrial membrane. So that's going to be damaged, and it's going to release cytochrome C. Next, lysosomes are damaged, the membrane of that, releasing lytic enzymes, and these lead to cell death. In addition, the plasma membrane is damaged, causing leaking of the cell. Finally, cell death. The hallmark of that is loss of nucleus. 3 stages in the loss of nucleus: piconosis, karyorexis, and karyolysis. We take the nucleus, and in a histological stain, you can see that the nucleus has condensed. In a very tiny spot, you can see a very deep purple color. The nucleus has first condensed, then it fragments, it breaks into pieces, small pieces. And then The nucleus disappears because it is broken down by enzymes inside the cell. Cell death is of two types. One is controlled cell death, where the nucleus tells the cell, okay, it's time to die now. This is a physiologic response and there's no inflammation. This involves individual cells. So I would like to remove this part. First, we take a cell that is going to apoptose. Similar to the above, loss of nucleus, it's first going to condense. And then it's going to break off, releasing apoptotic bodies into tissue fluid or blood. And this is going to be taken up by macrophages. These are a recycle system. Necrosis involves a group of cells, a large group of cells. It's always pathologic and inflammation always follows. This is seen in trauma, infection, hypoxia, and a lot of other conditions. So we are going to talk about the types of necrosis. First, I'm going to talk about, solid necrosis. In this word is called coagulative necrosis. An easy way to remember this is casein, that is the egg white protein, it coagulates when you heat it. Similarly, the proteins in the cell, they coagulate. Nucleus will disappear because the cell is dead, and it occurs in all organs except the brain. You can see wedge-shaped necrosis because the blood supply is cut off at the beginning of the wedge, so that the area under that do not get blood, get oxygen. You can see this in heart attacks. Next type is liquefactive necrosis. So liquefactive necrosis is liquid necrosis. You can see it's soft and liquid-like when those cells die. Brain always undergoes liquefactive necrosis. The other example, the one that will help you understand what this is pancreas. Acute pancreatitis causes the release of enzymes. Now, the pancreas produces all the enzymes that breaks down carbohydrates, proteins, and lipids. So you can see it will dissolve the pancreas. And the third type is an abscess. Abscess you will learn in inflammation. Others are a mixture of those two. First, caseous necrosis. This is a cheese-like necrosis. You can see it in tuberculosis and some fungal infections. It looks like cottage cheese. I'll show you the diagrams later on. Next, we have gangrene. The best example here is diabetic patients. Diabetic patients usually have their toes or their fingers, they become black, greenish black, and those cells are actually dying and dead. Or you can see in a frozen finger. If you freeze your finger, you can see that it's damaged in such a way that if the damage is serious enough, those cells die. The fingers can die, and you basically have to amputate those areas. First type is dry gangrene. You see it in toes mainly, especially in diabetic patients, and you have a clear border with the normal tissue. Next, if you superimpose an infection, or if it is in an area which is naturally wet, you can get wet gangrene. Best examples: small intestine, lungs, appendix, and the uterus. And the third type is gas gangrene. There are bacteria that produces gases. One example is Pseudomonas aeruginosa. This is a very dangerous situation because if the gases leak into blood vessels, the gases can accumulate and the patient will die. Next type is fat necrosis. So going back to the pancreatic enzymes, so pancreatic enzymes will break down fat, release it into blood, and into this, the calcium salts will come and precipitate on this. So circulating calcium will come and deposit, and this process is called saponification, which you will learn in heart under atherosclerosis. Now this type of precipitation is called dystrophic calcification, where the serum, the blood calcium levels are normal, and the calcium deposits on dead or dying tissue. Metastatic calcification is another type of calcification in which the serum calcium and the phosphates have increased. You see this in kidney diseases because there is increased reabsorption of calcium and phosphates back into blood, or due to a parathyroid hormone excess. And this type of calcification deposits in normal tissues. Next type is fibrinoid necrosis. I forgot to include the breast after trauma will also undergo fat necrosis. Next, fibrinoid necrosis. Fibrin deposits in dead tissues. So I'm going to quickly go through some cellular inclusions which I included in the PPT. First, proteins. During the process of cell injury and death, there will be proteins accumulated. Russell bodies are antibodies, precursors of antibodies, which are found in plasma cells. Mallory bodies are found in hepatocytes in patients with liver diseases such as alcoholic cirrhosis. Amyloid, these are misfolded beta proteins. This is very important. They stain red on Congo red stain, and these cannot be removed. They go and deposit in interstitial spaces between cells, and what happens is you have to remove the organ, otherwise you need to do organ transplant to these organs. You get this in diseases such as Alzheimer's, and to a certain degree, when you age, you become senile. You lose your brain power. That also is due to accumulation of amyloid bodies and stuff. Mucoid changes, production of mucus, where excess mucus is produced. You get it in asthma, wheezing, and hemosiderin. Hemo is iron. You get it. It's also called heart failure cells. These are brown particles, which again will be done in heart pathology. And lipofuscin granules. These are fat breakdown, also brown. Melanin is another example, black color. Bilirubin accumulates in hepatocytes, seen in viral hepatitis, and calcium can also accumulate. Again, there's three types of cells. Labile cells are cells which are always dividing. Example, bone marrow blood precursor cells. They keep dividing. These are stem cells which are always in the process of dividing. Next, stable cells. These are cells which, if needed, will start to divide. But it takes a little time to start dividing. This is important in terms of clinical aspects. And then there's permanent cells, cells which cannot divide. So when a nerve dies, it is replaced by glial cells, skeletal muscles and cardiac muscles. When cardiac muscle cells die, it leads to myocardial infarction. Next, repair. Granulation tissue, you can get normal function again in that organ. Granulation tissue is basically an accumulation of neutrophils, of repair fibrins, and everything that you need, blood vessels, everything you need to try to bring back the function. However, if the repair is impaired, or if there's too much fibrin or collagen deposits, it's going to lead to a permanent scar. A scar is permanent and there's no function in those organs. This is a very important thing that I need to tell you. A liver can regenerate. What does this mean? So let's say you cut off a piece of your liver over time, that piece of liver which is remaining will start to grow back into a new liver, because these are stable cells. Kidney and lungs can compensate because of a dual circulation. This is very important because you will hear this in pathophysiology. Dual circulation. That means these organs get a dual supply of blood from two sides. So if one side is impaired, the other side can still compensate. And we are going to talk about the slides and gross anatomy. So first, hypertrophy. This is a bit difficult to distinguish with by itself, but you can see the cell size has increased. Next, these are lipofuscin or brown atrophy granules. You can see the granules. This occurs due to lipid peroxidation, and this is a very important condition. It's called myositis ossificans. So first of all, after a trauma in the muscle, a hematoma, a localized accumulation of blood will occur. This blood is replaced later on by bone tissue. So if you were to look at the X-ray of this, you will see the bone tissue, and the way you distinguish it from a cancerous growth is by the clear border. So myositis, muscle, site, ossificans, bone. Metaplasia. Now you can first see the normal columnar cells, and on the right side you can see it's being replaced by squamous epithelia. And this is reversible injury. First is a normal liver. Next, water accumulates. You can see the eosinophilic nature has gone down. And last, fatty changes. You can see a large fat bubble with the nucleus pushed to the periphery. Next is hydrophic changes. You can see it's a gross anatomy of the liver. It's enlarged. The normal liver should be small, but there's water accumulation. And right next to it is fatty changes, fat accumulation. So fat accumulation in the heart leads to a tiger stripe appearance, where you get the red color muscle tissue, and right under that yellow color fat tissue. You get stripes of these. Hemosiderin, heart failure cells. This is accumulation of hemosiderin. Next, melanin. Melanin is a black substance produced by melanocytes, and then bilirubin, which is yellow, and this is dystrophic calcification. Calcium comes and deposits. This is coagulative necrosis. It's a wedge-shaped necrosis, and again, coagulative necrosis, you can see that there's no nucleus in the cells, and these are very firm cells. Unlike this, where you get kind of soft spaces. A brain liquefactive necrosis. Caseous necrosis, cheese-like necrosis. You can see this is like cheese. No cellular structures can be seen there. And this is gangrene. Gangrene can spread upwards, which is why you need to amputate the limb before it does. This is wet gangrene. You can see the black color of the small intestine. It has swollen. And this is fibrinoid necrosis. You can see fibrin has deposited. The eosinophilic straight fibers of fibrin. This is fat necrosis. Fat and calcium salts precipitate. You can see no nuclei. There's fat accumulated there. And apoptosis. The cell has shrunk from its normal size. So that's it for the first lecture on cellular injury. Hope you understood.